The heart sound recorder was developed by Royal Leib, and it's taken many years to reverse engineer his original development, which was called the Echocardiogram. And basically what it does is it listens to the valves and the muscular system of the heart. Hi, I'm Dr. Katie Thompson with the Health Improvement Center. This is the heart sound recorder, and we're going to discuss, and I want to show a demonstration of it because it can be a very vital component to looking for how someone's overall health is. What we do is we strap this on and we put it in different locations to listen to different valves. There are 4 valves in the heart. There's the mitral, the tricuspid, the aortic, and the pulmonic, and then those will show up on this screen. So I've pulled up my partner's graph so that you can see it. His work to rest ratio is a little too long, so we need to condense that. The other thing is the heart itself, that's the first heart sound, is a little weak. So I'm going to show you what normal looks like, and then you can see the difference. Here's what normal should look like. The work to rest ratio should be 2 to 1. So here's where the heart's working. You get lub, dub, then a rest, and then lub, dub, and then another rest, and so forth and so on. So you see how nice and tight that first heart sound is? And look at it compared to his. His is a little weak. So what we would do with this is we'd actually put him on some nutritional support to help strengthen that heart. Overall, it's pretty good. We just need to get a little stronger. Basically, if you've ever had an EKG, electrocardiogram, basically what it does is it listens to the electrical activity of the heart, and it will show damage after a heart attack. What this instrument does, the heart sound recorder, is it looks for the valvular contractions and the muscular contractions of the heart. And it can actually show us things that might happen. Now, it's not diagnosing, so I'm not diagnosing or treating any heart diseases, but it can tell me if there's some nutritional deficiency that's affecting the heart. And that's very important because our diets are so depleted in a lot of nutrients that it can show up in the heart pretty readily. For example, when you eat bread, particularly white bread, it leaches the B vitamins out of your body. When you don't have B vitamins, you don't get all the heart sounds that you should. Okay, so I'm going to show a different valve. So this is the tricuspid valve. Here's his aortic. And see how much stronger those are? This is lub, this is dub. Okay, and then here's the pulmonic. So again, lub, dub. His second heart sound is actually very good, but his first heart sound needs some work. And so we put him on a nutritional program to help strengthen the heart. This is a great tool for me to look and see what is going on and how best I can help somebody. And it can also give me a window into what else is going on in the body. So the heart sound recorder does 2 things. It shows me what's going on with the heart, but it also can show me what's going on system-wide. So it's a great, effective tool for both of those aspects. Well, I'm Dr. Katie Thompson, and this is the Health Improvement Center, and thanks for tuning in.